important and key role in ensuring that your voices are heard far, far, far beyond where we expect. So it is important for us and very, very unfortunate that the project is just for 3 months and that this particular engagement is supposed to happen like more than 3 times together so that we could be able to reach out to a lot of, discuss a lot of issues and try to see how we could support the process in our own context. But as I said, it's unfortunate that it's just for 3 months, and then we are rounding up, and we felt it's really key that we cannot close out this particular project without meeting the media to ensure that we reiterate the fact that access to healthcare services, particularly to women and children, is key for Gombe State, and that this could go a long way in reducing maternal mortality and child mortality within the state. So for our own engagement, we've tried to look at engaging the traditional and religious leaders at the community level. This we are hoping that it's going to be an own project for the community, since we are not going to be there for a long time. So we felt it is key that we involve the traditional and religious leaders to acquaint them with the right message on maternal newborn health, and then take proper action on how to sensitize the community through their sermons, through the community engagement with people to see that the message is passed across to ensure that women and children have access to healthcare services. And this has gone a long way for us, utilizing a fasting period for Muslim imams to support the sensitization through the tafsirs and also Friday prayers, as well as pastors and going to churches, because a lot of programs have been happening within the church premises, and this has also supported us a lot. So the second engagement was with the Chief's Agent and Mama Dunama, which they are people who are tirelessly working within the community to ensure demand generation. And then we felt to sit down with these people and try to strategize on the activities they're doing, because they have been in existence, but we're still having issues of maternal mortality and child mortality rate. So we felt we should find out what challenges they're facing and then try to change modalities on how to mobilize people within the community. And this has also gone a long way, where we saw evidence of them sensitizing people within the community, trying as much as possible to see that they mobilize people to the community. So this is the second engagement we had. The third engagement, still within the community, is to meet our youths, our women group, our men, people we see who are supporters of maternal newborn health, as well as sexual reproductive health, people like the National Union of Road Transport Workers, the persons with disability, who we feel they are excluded in all that we do. We felt it is very, very important for them to be part and parcel of this particular sensitization process to ensure that they sensitize their people on the need to access healthcare services, because of course they get married and then they get pregnant, but they do not access healthcare services. And this is a very, very serious concern to us as an organization, and we felt it is key we are incorporated in that. So we've done all this engagement, and the media is one key factor that we want to key in here to ensure that your voices are also heard, because we get to hear radio stations even inside the remote areas. So if eventually this project is being extended, I believe a lot of this engagement will be done more. But for this context, we are trying to see that this is not a new thing for all of you here, issues of maternal newborn health, as well as sexual and reproductive health. So it's just for us to reiterate the fact that it's very important and key for us to let our people know that it is important that we access healthcare services the earliest, especially early ANC, because it provides a lot of clue as to what the woman is going through, which tackles a lot of problems that comes after delivery or even before she gives birth. So this is a concern to Member State because looking at the indices and the scorecard for Gombe, we have a lot of red on early ANC as well as women accessing ANC more than 4 times. It's really a concern to Gombe State. So we are here to deliberate and to see what kind of support we are going to help us provide as media experts, what kind of coverage you feel you're going to support us with, particularly for this project. So thank you. If you have any question.